Hi, so let's start with asking you about TRT and heart disease. A common question: does TRT increase the risk of heart attack and strokes?
I know that a lot of the literature, primarily the older literature that's been out there online, has always suggested that one of the common side effects is an increase in heart attack, stroke, etc. We have to consider that TRT is a general term for testosterone replacement therapy. And as we know, more often than not, it is done incorrectly because it is still using these outdated protocols that have been around for years, primarily from the urological associations that have been infrequent injections sufficient to suppress or shut down endogenous production of the hormone where your body no longer produces it, but not sufficient to optimize and replace the levels that we're seeking. Not only are we then not producing or replacing sufficient testosterone levels, but all of the healthy and beneficial metabolites like 17 beta estradiol, dihydrotestosterone, and all of the upstream hormones that are impacted like DHEA, pregnenolone, et cetera, all of these pro-hormones and even brain chemicals like dopamine and serotonin, all of these things are going to be impacted when you supplement an exogenous hormone. And if you're not properly managing the big picture, both in terms of dosing frequency and types of medication specific to that individual, you're actually going to be doing them a disservice. So when we say, does TRT increase the risk, it really should be phrased, does mismanaged or improperly administered TRT increase the risk? And the answer to that is going to be yes. Risks are increased across the board on any medical protocol that is done improperly, right? Now, let's flip it around and let's assume that it is done properly and it is managed properly with a good level of understanding of what is entailed within a replacement therapy protocol. And then there is supervision and oversight on an ongoing basis indefinitely while the patient is under treatment, which, as we know, is supposed to be indefinite as well. In that case, not only have science and trials shown us that the risks are mitigated and reduced, but we've also seen significant evidence to show that low levels of testosterone that go ignored and untreated actually increase the risk of all-cause mortality. And that is evident because part of the aging process in men, and we know this because as we age, our testosterone levels are greatly reduced endogenously. And those that go ignored and untreated do suffer all age-related diseases, degenerative diseases of the brain, like Alzheimer's, dementia, etc. We find all the physiological changes like sarcopenia, which is age-related muscle loss. We find a traumatic decrease in bone mineral density over time, leading to osteoporosis, much more prevalent in women post-menopause, where the estrogen levels tank, being that men aromatize or convert testosterone into estradiol. It's not an endocrine hormone. We don't have ovaries that produce it, so we don't have an on-off switch like menopause. But as our testosterone level, being the raw ingredient of estrogen, begins to diminish, the estrogen levels in our body begin to diminish, and therefore, older men, you'll find brittle bones and porous bones due to osteopenia, and then eventually possibly osteoporosis. Some of it has to do with vitamin D deficiencies. Okay, and what do they tell women post-menopause? Take more calcium. Well, calcium is not going to help you if you're not absorbing it. In fact, it can only increase and harden the arteries, so it can actually cause harm. So we find that a deficiency in estrogen combined with a vitamin D deficiency, which most people tend to suffer with, because in this technologically advanced world, we no longer spend enough time in the sun, people are significantly losing bone mineral density. So properly managed and properly done with the right understanding and supervision, TRT can be a lifesaver when it comes to preventing heart disease, strokes, etc. The whole intrinsic coagulation aspect of will this cause an embolism or a blood clot, or again, this comes down to proper management, proper frequency and dosing, lifestyle changes, proper patient education on making those changes, okay? Because there's only so much you could do in the office, and then the rest of the time the patient's on their own. They need to have a constant line of communication to ask questions and not just say, well, I have an appointment in 3 months. Until then, let me lead a poor lifestyle till I get answers. So they need to have a constant ongoing process with their provider with an open line of communications and understanding and education, a complete lifestyle change if needed, so they're not in a self-destructive path. And then ultimately you'll find that TRT, when done right, will improve everything in your life, including lowering the risk of any of these mortalities that you asked about.
Okay, that's clear. Thanks.